Hi, my name is Elaine, and today I'm going to talk about deep brain stimulation. Deep brain stimulation is a neurosurgical procedure used most commonly to treat movement disorders like Parkinson's and tremors, for example. The surgery involves drilling 2 holes into the skull and inserting electrodes into specific regions of the brain, depending on the type of disorder being treated. A wire connects each electrode to a pulse generator, which is then programmed to deliver a certain voltage to the brain, and that's basically the gist of how DBS is set up. Wait a second. Don't sticking sharp objects and delivering shocks to the brain sound unsafe and even archaic in a way? It almost brings to mind psychiatric treatments of the past that we now decry, such as lobotomy or shock therapy. Actually, DBS is completely reversible and adjustable. Doctors can reprogram the voltage settings according to the patient's needs, and the idea of delivering electricity to the brain becomes less terrifying when we recognize that brain cells essentially communicate with each other with the use of electrical signals even under non-DBS conditions. These electrical signals that neurons use to communicate are called action potentials. Let's take a few seconds to explore this electrical communication process. A neuron in its resting state is more negative on the inside than on the outside. When the inside of the neuron reverses into a positive state, the neuron fires an action potential that triggers the release of neurotransmitters, aka the brain's chemical messengers. These little messengers then bind to another neuron and can serve to generate another action potential. Broadly speaking, when abnormal neuronal firing patterns occur, DBS's electrical stimulation can help bring these motor controlling circuits into a more balanced state of function so that symptoms of movement disorders subside. One argument against the usage of DBS is that it causes a change in a person's personal identity. Friends and family of patients sometimes claim that their loved ones develop new personalities after the surgery. DBS also brings into question the roles of a physician. In one case, a Dutch psychiatrist stopped DBS for a patient with OCD because even though the patient felt elevated levels of happiness after the treatment, the actual OCD symptoms failed to subside. The psychiatrist defended his actions by explaining that doctors are not in the business of trading happiness. If DBS fails to treat the symptoms of disease, then it's no longer a medical treatment but some kind of human enhancement, which is pretty interesting. Investigating topics that involve new technologies like the usage of DBS is important not just because it exposes us to science's amazing new breakthroughs, but also because it illuminates the fact that objective truth isn't always a thing in science, especially when it comes to novel ideas. In order to cultivate a critical approach towards science, it's important to recognize that the history of science has involved multiple clashes in competing theories. Exploring the ethics and mechanisms of DBS is an interesting and informative demonstration of this idea.